Hi, welcome to our case studies. These are the members, and let's get started to the shaky start for HealthCare.gov. HealthCare.gov was launched on October 1st, 2013, but visitors quickly encountered numerous technical problems. Software that assigned digital identity to enrollees ensured that they only saw their personal data was overwhelmed. Customers encountered cryptic error message and could not log onto the created accounts. Many users received codes that were incorrect because of features priced only based on 2 age groups. It was estimated that only 1% of the interested consumers were able to enroll through the website for the first week of operation, and many applications sent to ensure contained erroneous information. Thousands of enrollees for HealthCare.gov, at least 1 in 5 at the height of the problem, received inaccurate assignment for Medicaid or private health plans. Some people were wrongly denied coverage. The HealthCare.gov project was so important as this would closely link to the Patient Protection and Affordable Care Act, often called Obamacare. As this Obamacare was the centerpiece of President Obama's legacy, HealthCare.gov project too was driven with high political influence. From users' point of view, this HealthCare.gov project was also an ideal concept that allowed people to locate and enroll in the best health insurance plan that's custom fit for each individual, or even inform them whether they are eligible for government healthcare subsidized or not. As HealthCare.gov allowed searchers to link even to private health insurance, it also was a potential marketplace for small businesses. The key risk factors in the project can be divided into 3 large groups: selection contractors, improper design and planning, and cooperation error. The selection inexperienced contractor may have contributed to the shaky start of HealthCare.gov. Other experienced contractors may have approached and handled this project differently. The way how the project was designed and planned definitely affect the outcome of it. And lastly, lack of cooperation as the team factors in a lot. The U.S. Chief Technology Officer Todd Park stated on October 6 that HealthCare.gov glitches were caused by unexpectedly high volume of users. Between 50,000 and 60,000 had been expected, but the site had to handle 250,000 simultaneous users. More than 8.1 million people visited HealthCare.gov between October 1st, 2013 and October 4th, 2013. A major contributor to this problem was part of the system design that required users to create individual accounts before shopping health insurance. This means that before users can shop for converged amount, separate computer system built or run over by multiple vendors, including CGI Groups, developer of HealthCare.gov, Quality Software Service, and Credit Checker at Experience LC. If any of these websites fail to work properly, users will be blocked from entering the exchange marketplace. The bottleneck has been created where the system interacts with a software component called Oracle Identity Manager supplied by Oracle Corporations, which embed the government identity checking system. This problem may have been averted if the system allowed users to browse plans without first going through the complex registration first. White House officer later admitted that HealthCare.gov problems were not caused only by high traffic volume but also by the software and system design issues. Stress tests performed by contractors a day before launch the date revealed that the site slowed substantially with only 1,000 simultaneous users, far fewer than 50,000 and 60,000 were anticipated. Technical experts found out that the website was riddled with hardware and software defects. Working on fixing the website continued through October and November 2013, and the website appeared to be working more smoothly. For the vast majority of users, HealthCare.gov was working for more than 90% of the time. Response time was reduced from 8 seconds to less than 1. The incidence of error message preventing people from using the site went from 6% down to 0.75%. By November 13th, only 130,000 people had signed up for private healthcare insurance, far fewer than government forecasts. HealthCare.gov program was the first Obama administration to delay by 1 year an online exchange for small businesses. As mentioned in the key risk factors, before assigning CIG for HealthCare.gov website project, a thorough background investigation should have been conducted. Secondly, during designing and planning for the website, they could have designed the website better so that the user didn't have to sign in to retrieve some information, having more than just 2 group age for price differences, having higher expected traffic volume and not using MarketLogic's data management handling. And lastly, all parties could have been communicated effectively and cooperated by extending the unrealistic deadlines, having less changes on policies and regulation, attending to suggestions made by contractors, having a single leader in decision making, and having more communication between computer specialists and CMS. A major contributor to this problem was part of a system design that required users to create individual accounts before shopping health insurance. This means that before users can shop for converged amount, separate computer system built or run over by multiple vendors, including CGI Groups, developer of HealthCare.gov, Quality Software Service, and credit checker at Experience LC. If any of these websites fail to work properly, users will be blocked from entering the exchange marketplace. The bottleneck has been created where the system interacts with the software component called Oracle Identity Manager supplied by Oracle Corporations, which embed the government identity checking system. This problem may have been averted and the system allowed users to browse plans without first going through the complex registration first. After that bumpy debut, HealthCare.gov appeared in 2015 to be running smoothly. There has been few minor, short-lived technical glitches. The Obama administration was able to boost the enrollment of 11 million people in the healthcare plan for 2015, surpassed the president's goal. Thanks for listening.